Well, although COVID-19 has sometimes made it hard to smile, neglecting dental care during the pandemic can be very problematic. We have Dr. Richard Gesker. He is the Chief Dental Officer for UnitedHealthcare. Welcome.
Thank you for having us.
I'm happy to have you here because I know that February is National Children's Dental Health Month. Can you share some good oral tips, health tips for parents and their kids?
Absolutely. Parents will want to start early by cleaning their baby's gums with a soft cloth and warm water. Starting around age 2, introducing a soft bristle brush with just a dab of fluoride toothpaste is essential. But please teach your child how to spit out the toothpaste. And when the back teeth begin to erupt, parents need to teach their children, yes, how to floss. This all promotes good gum health, avoids gingivitis, and prevents cavities.
And it's funny when you do that early, sometimes the kids are the ones telling you. My daughter is 7 now, and we started very early, and she'll be like, Mom, I'm out of floss. Mom, I do not remember being that way when I was that age. So you're right about starting very early because it just becomes second nature to them. For people who have delayed trips to the dentist, and I am not pointing fingers because I was one of them at the beginning of the pandemic, how can they improve their oral hygiene at home?
Well, it's time to double down on what we all already know, but sometimes don't do. At UnitedHealthcare, we do recommend brushing your teeth twice a day for 2 minutes, which can be a long time, and after meals. And of course, before bed. Then rinsing with some mouthwash for 30 seconds is a good option too. But flossing daily is the key, and consider adding a water flosser and a tongue scraper for additional health and great breath.
All right. Okay. So upgrade our equipment as well if we don't have those things. And for people who have delayed, the trips to the dentist, those are great tips for at home, but we still need to make those appointments and get in there, correct?
This is absolutely correct. Let me be very clear here. The American Dental Association recommends checkups, cleanings, and routine care to continue during COVID-19. However, please avoid non-emergency, non-urgent care if you're living in a place with intense, uncontrolled spread of COVID-19.
Okay. And when we go in for those checkups, what should we as parents be aware of to ask about just to ensure that our children are maintaining, a very healthy smile and overall health of the mouth?
Well, focus on prevention. Parents should consider fluoride treatments, which strengthens and hardens the tooth enamel and protects the teeth from decay, and sealants, which are plastic-like coatings applied kind of like nail polish to the back teeth to protect them from decay. But for children with a significant number of cavities, silver diamine fluoride is a great option to discuss with your dentist. This type of treatment, however, only slows the progression of the cavities, but we do want these cavities filled. This is also a good option for children and older adults with a significant history of tooth decay.
That is good to know. And one last question for you. We've heard a lot about telehealth with our medical doctors, but what about for our dentistry, for teledentistry?
Yes.
Is that something that people should be aware of?
Yes, virtual care has become so very important as people are trying to avoid face-to-face interactions, and some dentists and dental plans are making telephone and video consultations available, also known as teledentistry. But this option is only a starting point for care and advice to select the best setting that you feel comfortable with for in-person care. Keep in mind, dental care ranks among the most frequent and avoidable emergency room visit. So teledentistry helps people make informed decisions as to where to go for in-person care, their own dentist, another available local dentist, or even their primary care physician.
All right. Dr. Gesker, thank you so much for helping us brush up on our oral health. Bum, bum, like that.
I do. And thank you for having us.
Thanks. For more information, of course, you can go to uhc.com. We will be right back with more Midday Maryland right after this. Stay tuned.